Which of the following screenings should be tracked for women above the age of 40? So option A says pap smears only. And remember, when we see words like only, that's usually not the answer that we're looking for, because that implies that this is the only screening that we're focusing on when there are other screenings. Also, something to keep in mind is that it's saying for above the age of 40, and pap smears typically begin before that point. It usually is once a woman becomes sexually active or when they're 18 years old. That's usually when we would start beginning pap smears. So we can eliminate option A. Option B says colonoscopy, but for every 5 years. And that's actually something that could vary. Some people do it sooner. They might do it closer together as every 1 year, every 2 years, depending on what kind of healthcare needs they have. And also, some people begin more around the age of 50. This is saying at the age of 40, but that's something that they would discuss with their provider. Maybe if they're a higher risk patient, that's something that they would begin earlier. So this probably isn't the right answer, so I'll eliminate it, but we might come back. Option C says annual mammograms and bone density scans every other year. And that's also something that could really be dependent on other factors. When it says every other year, maybe they need to have it sooner if they have a high risk for breast cancer and they've had something in the past. So that's something that could vary. So we can eliminate that. And then option D says individualized screening plan based on risk factors and health history. And that goes back to what we were saying, that these factors really could vary depending on what kind of history the patient has. So that really is a better suited answer. So we will go with option D.